Hello, my name is Pedro Figueroa. I am currently a student of the Bachelor's in Science in Nursing program at the North Hollywood campus of West Coast University. I would like to thank all of you for your time and the opportunity to participate in the Oxford Honors Program. I have recently started this term with OB, Disaster Management, and Nursing Research. I am excited by all of them, although a little intimidated by OB. I was introduced to the concept of globalization when studying Masters in Business Administration program. I learned that it's important to differentiate between globalization and internationalization. I have recently found out when talking to many of my classmates that they often mistake the concept of global healthcare with international health. Internationalization in relation to health is the exchange of health services between two nations, and it often relates to public health and aid provided to disadvantaged nations. The concept of globalization in healthcare, on the other hand, is a more all-encompassing concept, and it seeks to improve the health and provide an equal level of care worldwide to all cultures and nations. Now, applying the global concept to healthcare and nursing seems rather intuitive, as we're taught beginning in our fundamentals class that we must provide the same competent level and quality of care to all our patients in all settings and environments, and that patient care must be adapted and customized to always take into consideration the patient's cultural, religious, and even personal preferences. Evidence-based practice is also inherently tied to the globalization of healthcare, as it is enriched by the availability of existing research from all over the world and the possibility of healthcare professionals to customize and apply that knowledge to the particular case, setting, and environment. A baccalaureate-prepared registered nurse in a global healthcare environment then has the ability to contribute to and use global resources to optimize and adapt patient care while maintaining the same competent and compassionate level of care when dealing with a wide spectrum of cultures, nationalities, and religions. The qualities of a successful nurse in a global healthcare environment must then include cultural sensitivity, knowledge of physiological and disease processes, knowledge of accepted medical and nursing procedures, ability to think critically, learn and adapt quickly, ability to use verbal and non-verbal communication, empathy, and compassion. I have had the fortune of traveling, living, and working in different countries in South, Central, and North America and Europe. I also speak 4 languages. I would consider myself cultural sensitive, but during patient interaction, during my clinical rotations, I have learned that one must be very sensitive and aware of cultural differences, even if you do speak the same language. As I mentioned before, I am still learning the nursing profession, so I believe the most obvious quality I would need to continue developing is knowledge about physical and disease processes and of medical and nursing procedures. Also, I have always thought myself as a compassionate and empathetic person, in a social sense. But during my clinical rotations, I have learned that a nurse is able to use empathy as a diagnostic tool and compassion as a therapeutic one. I still feel that I have much to learn about these two concepts, and to practice being able to control and display emotions with my patients. Although it is not obvious in every specialty, I have noticed in our mental health class and clinical rotations that mental health nurses have a very characteristic calmness in their demeanor and communication style. I would like to develop this skill. I believe that in our time in Oxford, we will be able to gain a greater perspective of healthcare and of nursing. We will also be challenged to excel, as we will be representing not only our West Coast University, but the United States as a nation. I believe our university is an important representation of the diversity that exists in the United States, because as we can see in our classrooms, there are students from every background and all with the same goal of becoming a nurse. I would also like to take the time now to thank all of my professors at West Coast University who have made the nursing program enjoyable, and of course those who have made it very challenging. A combination of both does keep things interesting. It has not been an easy road, and I did not expect it to be, but I'm halfway there, and with each term I can see and feel my skills improving. As knowledge of medication and procedures become second nature, and little by little I am able to understand the meaning of evidence-based practice and its relevance to the healthcare profession. Once again, I would like to thank you for this learning opportunity and look forward to your favorable response. Thank you.